The Psychological Evaluation and Intervention Group, HUM-836, is interested in a wide range of areas, from the creation of instruments for evaluating psychological variables, for example, anxiety in women with high-risk pregnancies, expressed emotion, empathy, and resilience, to methods of diagnosis and intervention in hand tremors, i.e. the thermometer bar, to smartphone applications for women at risk of abuse. Lately, we are interested in the infant and child population, especially anxiety disorders and early intervention. The group has the following lines of research: cognitive rehabilitation and psychosocial intervention in schizophrenia, evaluation and intervention in children and adolescents, study of risk and protective factors in drug use, and discrimination and prejudice. Tremors, or involuntary rhythmic muscle contractions, are a typical symptom of any number of disorders and diseases, including Parkinson's and multiple sclerosis. When they are very intense, they can be highly debilitating. We have therefore invented the thermometer, which is a device capable of measuring tremors in 3 dimensions, in order to facilitate the diagnosis of these disorders. The action itself doubles as a rehabilitation exercise, reducing these tremors. Our goal within the research area of early childhood intervention emphasizes 3 basic things: the adoption of early prevention measures, prenatal diagnosis and support for families during this time period, and intervention work with both the children and their families. Another line of research is related to the stress faced by parents whose children have disabilities. Our aim is to identify what these specific stressors are, tailor screening techniques, and create personalized treatment programs to improve their skills and abilities. We all know people who, after suffering a loss or crisis of some kind, not only overcome the situation, but actually experience an improvement in their quality of life and well-being as a result. This ability to cope with adversity is called resilience, and our group seeks to identify the many variables that influence it, for example, age and cultural factors. Recently, our research group has conducted various surveys in the Spanish population regarding resilience. With this information, our intention is to create training programs and intervention methods that can help people improve their level of resilience when facing a traumatic situation. Another area of our research focuses on the assessment and intervention of anxiety problems in both children and adolescents. Within the research group, we also investigate the occurrence of gender violence from 2 perspectives: intervention and research. It is common for women victims of gender violence who come to the psychology clinic at the University of Jaén to come in for other complaints, such as distress, anxiety, post-traumatic stress, and low self-esteem. We assess these symptoms using a series of questionnaires, one of which was designed especially for the early detection of gender violence, which can manifest in many possible forms of abuse or partner violence. This last questionnaire was created by the research group. We identify 3 lines of research in our investigation. One is related to the study of people's myths and stereotypes about the occurrence of gender violence, and the other 2 are related to the victim and the aggressor. Among other aspects, we examine the degree of empathy between the 2 partners, the victim's forgiveness of the aggressor, and attitudes about the victims returning to the former partner. In our research group, we are dedicated to the study of cognitive functioning in people with severe mental illness, in particular those with psychosis. Most of our work has focused on the accurate assessment of their cognitive functioning and the neuropsychological rehabilitation of deteriorated functions. We've been working for 20 years on approaches to neuropsychological rehabilitation for people with schizophrenia and other psychoses. To do this, we mainly use computer programs, which allow us to individualize the intervention process for patients. Regarding the evaluation process for cognitive functions, our group has developed a task to evaluate divided attention, that is, the ability to perform 2 tasks at once. This capability is critical to performing the tasks and activities of everyday life. In the area of drug dependence, our goal is to understand the consumption habits of university students. We are interested in their socio-demographic profile, as well as any family history of drug abuse. We also want to know what drugs they take, and what are the consumption patterns, motivations, beliefs, and perceptions associated with drug use, in order to design effective preventative measures in the consumption of drugs and all its associated problems. Business sectors and/or public entities to whom the research is directed. Learning centers, special education centers, businesses, public safety workers, rehabilitation centers for drug addicts, and social services.